traditional medicine. When I talk about traditional medicine, I'm talking about hospitals, pharmaceutical companies, anybody in medicine, anybody who makes their money in medicine, who gets reimbursed from insurance companies. They don't make money off of two types of people, healthy people and dead people. They make money off of chronically sick people. It's like a built-in incentive structure, but it would be nice if you had a healthcare system where doctors were incentivized to keep you healthy. They don't have a platform for telling people about all these health hacks that keep people healthy. And I thought it would be fascinating to tell everybody about that and really spotlight the people that are making this happen, staying vital, staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This show comes out every Tuesday. Always looking for the latest, greatest health hacks. We've already covered an enormous amount of information. This is a really exciting show. And so what we ask you to do, if you're listening to this on just the audio, subscribe to it at iTunes. Just hit that subscribe button.
Hello, this is Mark L. White with Health Hacks, and I'm so honored today to have Dr. Lamia Gabal, and I hope I said that right. Lamia Gabal.
Lamia Gabal, yes.
And
yes.
Gabal like ball because you're a urologist.
Exactly.
So I love trying to make that connection here. But Dr. Gabal is visiting us from Newport Beach. She came all the way to South Florida. Urologist, but she's here to talk about something I never thought I'd talk about on the show, which is urinary tract infection and simple health hacks on how to avoid it. Welcome to the show, Dr. Gabal.
Thank you so much, Mark. Thank you. I really am privileged to be here. Thank you.
I guess my first question is, you don't see a lot of females that decide, I'm going to go into urology.
Yes.
And I always want to know your backstory. So why did we decide to go into urology?
So in fact, when I first made the decision, my sister thought it was to meet men. And I explained to her, no, it's most of our patients would be older and possibly have need Gainswave. And so I said, no, it was really that there was a big need for women in urology. And in my surgical rotations, I loved every rotation that I did. And then it literally was the last rotation. I tried to give it away because I had no idea what a urologist even did. I'd never heard of urology. But then I did the rotation. I love the people. Most urologists have a good sense of humor. The lifestyle is great in that there's not many emergencies, Mm-hmm. And I noticed that there was a shortage of women because, and many women end up with urological issues. And at the time, only 4% of board certified urologists were female. So.
It's funny because when we think about OBGYNs, we don't think twice about the fact that most OBGYNs are men.
Yes.
Yet when you say I'm a urologist and I'm a woman, it's funny how society thinks that way.
Yeah, well, traditionally urology is thought of, I think, as a male gynecology specialty, but we treat much more than just the genitalia. We treat stress urinary incontinence, urge incontinence, overactive bladder, recurrent UTIs, and then things that happen in both men and women, like bladder cancer, kidney stones, those kinds of things. And most people just want a good doctor. I tell my male patients there's a good reason to have a female urologist. We have smaller fingers than the guys. So, there's just, everyone's got to have a gimmick. And so, but it's been very good. It's been a good decision.
Yeah, I don't look for urologists with fat fingers. So
Exactly.
I'll keep that in mind. So one of your specialties, obviously, you talk about restorative surgeries.
Yes.
You talk about things that help guys. What's the biggest need that you see right now in men? What are they coming to you for? Is it ED? Is it other things? Is it?
Well, many of the men that come into our practice do come in for erectile dysfunction, and we're seeing younger and younger men coming in, and I think it's just been easier for them to talk about, and I think Gainswave has actually done a great job with that in making it easier, but also your predecessor, Viagra, things that are out there that make it easier for patients to talk about, and they know that they have options.
Do you see a lot of guys that are coming to you because they want, I hear about lengthening penis, or surgeries about that? Because I've heard crazy urology stories.
Yeah,
What's the craziest story?
Oh, you want my craziest story?
Well, I'd love to hear your craziest story.
I know most of my crazy stories were actually from residency at UC San Diego. There was, when I was in the operating room, I got a phone call from a clinic that there was a man who had a penis ring, we'll call it a penile occlusive ring or a cock ring, stuck behind his testicles for 2 days. And so that was for 48 hours. And he'd come in to seek, obviously he'd been embarrassed, he didn't want to come in earlier, and it was a metal penile occlusive band. And so in my head, I was imagining having to take him to the operating room and that there was so much swelling and it's been a long day. I was just finishing my last case. And so one of the techs mentioned, Dr. Gabal, you should take these big bolt cutters and see if that might work. I said, I don't want to scare the poor guy. So I went down there and remarked.
You would need a lot of anesthesia for that.
Right, but a woman coming at you with bolt cutters to your genitals. However, by the time I got there.
Some guys might like that.
Yeah, I know they might be into that. But there was remarkably not very much swelling, not very much edema, and I was able to get my fingers around it.
Small fingers.
Yes, I have smaller fingers. So I said, sir, I'm going to save you and me a lot of time and energy right now. I don't think we need to go to the operating room as I had expected. I'm going to go get these bolt cutters. And he was very brave, and he helped, and he put his, he held back his jewels while I was doing the cutting. And then it was so thick that I had to cut both ends in order to separate it into two pieces.
I love watching the hand signals. So people listening to this on the podcast, I'm getting all the details.
Yes, with my gesticulations. And so at the end of it, he was so grateful. Thank you, Doc. This has just been you've been so helpful. Would you like to keep a half for because I want to keep the other half to show my friends.
You still have that half?
No, I left it in the clinic at UCSD. It's probably still hanging there from many years ago. But yes, we have urologists are really fun at parties. We have good stories.
I can imagine. It's funny because I think guys will, like, the moment something happens that involves the penis, they're on the phone, they're trying to figure it out. Whereas they could have chest pains, they could have other things going on. They don't want to see the doctor. But the moment something's not working just right, you're getting called.
Yeah, this is very true. It's a very important organ. We realize that.
So let's talk about urinary tract infection. Now describe what that is.
So the urinary tract would involve the kidneys, ureters, bladder, urethra, and in men also prostate and testicles are part of the urinary tract. People don't realize that. So a urinary tract infection, most people know as a bladder infection or a UTI. That would be defined as cystitis. You could also have prostatitis, which is an infection of the prostate. You can have epididymitis or orchitis, which is an infection of the testicles or the structure above the testicles, and then in the scrotum. And then you can have pyelonephritis, which is usually much more serious, and that involves a fever and usually sometimes hospital admissions. And then all of those things can evolve into sepsis and even death. So it's very, very serious. I mean, these are things that we deal with a lot as surgeons, because if there's a structural abnormality that can be addressed, then it would need to be fixed. If there's a kidney stone, if there's an anatomical, if there's something wrong with the anatomy, if the patient isn't emptying their bladder, those are all things that can predispose them to having urinary tract infections.
And then antibiotics, I know, is working less and less these days. You have to hit it with more and more types.
And we try to avoid antibiotics if we can, because we are getting more and more resistance to antibiotics. However, antibiotics are also life-saving in some instances. So every day I have the discussion of risks and benefits with my patients, and everything in life is risks and benefits, whether it's driving a car, taking an antibiotic, having a procedure. There's risks and there's benefits. And so, we try not to subject our patients to antibiotics. If possible, the best thing is prevention, if we can prevent the urinary tract infections. But once someone has a UTI, antibiotics can be life-saving, actually.
So what's the health hack how guys can prevent getting a urinary tract infection? Because it sounds painful.
Yes. Well, so for men, the health hack is drinking lots of water. Really, if I see, especially some younger men who get urinary tract infections, dehydration is probably the biggest issue in men who get UTIs. But UTIs are, urinary tract infections are much, much more common in women. Our urethras are smaller, usually. And so...
Unless the guy has micro penis.
Exactly. And so much more closer to the anus. And so when you're that close to the fecal stream, when things are so close, the normal bacteria that live in that area get more access into the urethra and can increase the risk for urinary tract infections. Many people will say, oh, but doctor, I don't know why I get this. I wipe from front to back and I'm clean. I make my husband take a shower, after sex. I take a shower, because sex can increase the risk for UTIs in women as well. But it has nothing to do with not being clean usually it really does come down to some structural abnormality or dehydration, but not emptying the bladder completely, having kidney stones, or in women, prolapse is a big factor in terms of urinary tract infections. And, if the bladder's dropped, if the rectum has dropped, this comes after childbirth, then that increases the risk because you don't empty the bladder, you don't empty the bowels completely. There's more bacteria that live in that area, and that increases the risk for the UTIs.
So that's really about reconstruction of the pelvic floor.
Exactly. And so that is part of my specialty, is fixing the pelvic floor and putting things back to where they're supposed to be so that they can empty their bladder and their bowels better. But one of the health hacks for women that I recommend every day for preventing urinary tract infections is a bidet.
So let's talk about bidets, because I think that can apply to both men and women.
Yes.
So the way we avoid urinary tract infection is keep our butts clean.
Yeah, well, to keep, to stay away from constipation and to be able to empty the bowels more completely. Again, it's not necessarily about, my patients are also almost always very concerned about, I'm clean, I'm a clean person, but it's just about not emptying, not evacuating completely. And so by having a bidet and even using it as a little enema, not only is it fun, but it can help for urinary tract infections because it empties the bowels more completely, it decreases the number of bacteria in the area, and that in turn decreases the risk for urinary tract infections.
It's funny, when we first moved into our house 20 years ago, there was a bidet next to our toilet. There was a bidet. Separate bidet. And, I guess growing up in the U.S., and you're from another
Yes,
country,
I was born in
right?
Cairo. I'm from Egypt.
So you're from Egypt. So growing up in the U.S., you're not used to seeing a bidet. And I was thinking, this is a great watering bowl for my dog. And
what else do I do with this
what
thing?
else do I do with it? But then when we would travel, we've traveled to Dubai, we've traveled to Japan, you see bidets everywhere.
Yeah.
And so I'm thinking to myself, is it us in the U.S. who are kind of backwards and the other countries get it? Because wiping with paper, is that what?
No, it's really interesting. The rest of the world laughs at us for wiping our bottoms using dry paper. We're just kind of smearing the bacteria around in that area. You're not really getting clean. So many people have taken to using disposable wipes, and that's not a bad option. But again, if it's a matter of actually emptying the bowels, the bidet helps more with that. It really does. And I think they're ahead of us when it comes to that.
Okay, and then are there types, should everybody just listen to this, say, you know what, I hear you, I'm going to go out and get a bidet?
Well, so there are different types. Apparently, there's a medical grade bidet that's coming on the market that also is going to be spraying a skin barrier onto the perineum, onto the area between the anus and the vagina on women, or between the testicles and the rectum on men. But if you just get one on Amazon, ours at our house is the $600 Toto that you add to your toilet. From Amazon, your plumber can do it. All you need is the plumbing and electricity, and it's super easy. My 10-year-old loves it.
It's funny because in Japan, any toilet you go into, it doesn't matter if you're at the train station, it doesn't matter if you're in a public park, the toilet has a bidet in it.
Yes.
And what's amazing is the toilets there are clean. The toilets there heat up. They do all kinds of crazy things. There are even toilets that will play music while you sit on them to hide any crazy noises coming out of there.
Well, that's the other thing is you can go crazy with the type of bidet that you want. You can have all kinds of bells and whistles. You can have a remote control that if you really wanted to mess with whoever's sitting on it, you can do it from another room and change
speed up the water pressure.
Exactly. You can do front water, back water. You can do different temperatures and pressures.
Some
and
people
the seat.
can have fun with this.
Yes, exactly. But it really is, I think, for some people it's a necessity, but I think it's a nice thing to be able to prevent infections.
Why don't you think bidets have caught on in our culture?
Yeah, that's a good question. I think, for many, many years, people just don't feel comfortable addressing their genitals. I still have patients in my practice who, I have women in my practice who don't know that they have 3 different holes in that area. I have men that when I'm trying to teach them.
There's probably people listening to this podcast who don't realize women have 3 different holes in that area. Let's talk about that.
I know.
What are those holes?
There's pee, penis, and poop. Those are the 3 holes. One pee comes out of one, poop comes out of one, penis goes into the other. So there's 3 holes in the female perineum, the 3 P's. But that's the thing is that people aren't comfortable talking about their own anatomy, and maybe that's one of the reasons I went into urology. I have no problem. I grew up in an auto parts store. I don't know if you know that. My dad had an auto parts store growing up in Anaheim. It was called King Tut Auto Parts. Okay. So I'm really just one of the guys, and that's what I tell my patients. If they get embarrassed about talking to a woman about some of these issues, I'm like, really, I'm not. I'm no lady. I'm a urologist. Drop your pants. This is
guys actually. You probably get guys opening up more to you about their genitalia than they would a guy.
I think there's definitely different schools of thought on that, and we were just having this discussion last night at dinner that. And I've had friends tell me, Lamia, no offense, there's no way I'd ever come to you. I'd have a woody if you were examining me. Well, that's okay.
Do you ever get guys with woodies?
Oh yeah, that happens. It's just a reflex.
Are they embarrassed? Are they?
I mean, we don't. It's kind of the elephant in the room, if you will. We don't mention it, but
if they have ED and they get a woody, they could say, doctor, you've done a great job.
Obviously, I fixed you. So you no longer need my treatment. You just need a new partner. But I know, which can be the case. But
how do you address that one?
I explained to them that the machinery is working, and there's many different causes for erectile dysfunction.
Psychological.
Yeah, many different causes. I mean, the brain is the biggest sexual organ that we have, and if that's not okay in the bedroom, then everything's not going to be going right. And so, obviously, your machinery is working. Maybe you need to work on the interpersonal relationship.
Everybody's been reading about the influx of porn. I have a teenage son who. When we first started with Gainswave, we were advertising it years ago on Pornhub. He's like, Daddy, I saw your ad on Pornhub. I was like, oh, God. But it's porn right now and the influx of porn because, when I was growing up, porn wasn't like it is today. But I'm hearing from doctors, though, that this is a public health crisis, and this is why guys can't have normal sex anymore. What do you think about that?
I do feel like these are standards that people can't live up to. I mean, people come in saying, my penis is too small. Well, why do you think that? Because, I've seen the guys on porn. Well, why do you think they're on porn? It's because they are actually more than average, and people do have expectations set.
By the way, nobody knows, what is the average penis size for guys out there?
It depends on if you're talking about flaccid or erect or, it's just a wide range. And so, there have been some studies, and it really does range by country. It ranges by race. There's many different things that play into it. And to be honest, if you look at a certain geographical area, the penis size kind of matches the vagina size in that geographical area if you look at that. There's different studies that look at, the size of the people. Those are things that I ask because when I do vaginal reconstructions, I want to know who my patient's partner is because I don't want to make things so small that her partner can no longer get in there, that she's going to be having painful sex. So, there's disparities that can be an issue. But for the most part, average would be like 4 to 6 centimeters. That's not very big, elongated.
So in inches,
Elongated.
that's like 2 to 3 inches.
Yeah, elongated, meaning not erect,
Yeah, so
but
it's
just
like-
pulled out.
You made me feel really good when
pulled
you
out
before
flaccid. Yes.
pulled out flaccid. Got it. And then and then you talk about size. You talk about people just psychologically. Do you see a lot of people coming to you because there's a psychological issue?
It's funny, when I first did my residency, we thought that was the only cause for erectile dysfunction. We said it had to be psychological, and we'd say there's nothing we can do for you. Just go home, have some therapy, and it'll hopefully get better, or find a new partner. And so, with the onset of Viagra, which I think everyone knows how Viagra was found, right? The accident of high blood pressure medication being tested. But then we realized, wow, it's more than just psychological. There's vascular issues. I mean, there's so many things that play into the being able to have an erection. So my job as a urologist is to rule out the medical issues, make sure the testosterone is okay, make sure the anatomy is okay, make sure there's no infection, make sure the blood flow is okay. I mean, those are things that I think I'm obligated to do as a urologist. And then reassure the patient that this is normal, we can fix it if it's an issue, and then give them the many options that are available.
What age are you seeing a lot of people for ED?
Usually in the 50s to 60s, but it ranges. I mean, we've got guys in their 20s who come in who have difficulties achieving or maintaining 100% of an erection. I have men who are in their 90s who really want to have sex still every day with their partners. So there's it's so individual.
That's usually vascular that you're noticing it? Like when you do all of it, is it low testosterone?
No, the most common cause for erectile dysfunction is vascular or neurogenic. What a lot of people don't realize is the spine has so much to do with it. With voiding dysfunction, with defecatory or pooping dysfunction, we were talking about the bidets, and with erectile dysfunction. Many men with like L4 to S1, L4, L5, S1 spine disease have difficulties achieving and maintaining 100% of an erection because of the neurologic component.
Does Viagra work for that?
It can, yeah, it definitely can.
And I know you're doing GainsWave. How long have you been doing GainsWave for?
We've been doing it for almost a year in our practice.
Tell us a little bit about what you're seeing, what type of guys it helps, who it's not for.
Such success with it. And not only men who are having difficulties achieving, but in the younger men who just want to maintain, what they have. What I've been telling my patients is that we're able to set the clock back 10 years. And depending on the severity of their ED, if they are on Viagra but don't like taking it, they want to be more spontaneous, after 6 sessions, we have like 80 to 90% success getting them off of Viagra, or at least using a lower dose. If they don't have any success with the oral medications, it's a little bit more tricky. It's a little bit more difficult, but we do have, I think, some success in seeing them be able to at least use the higher doses of the medications if they're doing the higher number of GainsWave, as well as with PRP.
Now we've seen in our practice people's refractionary time decrease. Have you heard that?
Yes, I've heard that from my patients. They're able to have more sex more quickly, and also size has been increased with GainsWave. And it kind of makes sense. It's something that we also have learned over the years, that the penis is a use it or lose it organ. And I have men who come in older who happen to have erectile dysfunction or maybe haven't been sexually active in so long, and they're saying that their penis has shrunken. And even though there is no muscle in the penis, it atrophies. The tissues atrophy. They thin out. The skin, the blood vessels. And so the more you use it, the size will also increase.
So did you ever write a prescription for a guy to take home to his wife or girlfriend saying,
believe it or not,
use it 3 times a day or else you're going to lose it?
Maybe not that often. I also feel for the woman's vagina. But I do write sometimes on a prescription pad, frequent intercourse, frequent sex, or frequent ejaculations, because it helps. It's a use it or lose it organ.
And what happens when the guy's in a relationship that he wants to have a lot of sex, but it's hurting her. What does the couple do?
Yeah, so pelvic pain in women, dyspareunia is the medical term that we use for pain with sex in women. It's huge, and it's a big issue. And unfortunately, women, we're much more complicated than men. I don't know if you realize that.
No.
Just a little
we
bit.
can even just talk about hormone levels.
No, it's so much more complicated. And so there's so many things that can cause pain with intercourse in women. It's a big thing in my practice that we do address. It could be as simple as an undiagnosed urinary tract infection, as we were talking about before, because the bladder hurts if you're rubbing the backside of it and it's irritated, if you have an infection. It could be after menopause, there's thinning of the vaginal tissues that cause pain. It could be something called pelvic floor dysfunction, which is muscle spasms. That's very, very under-recognized. There's so many things that can play into the pain with intercourse. And so, I tell all of my patients that if it's a partner issue, have them come see us as well. I'm happy to treat couples. They're the happiest.
Do you get husband and wife couples that come?
I have, and that's always the biggest compliment. I have families that I'm treating, where I'm treating the mother, the father, the kids who are maybe adult kids. It really is such a compliment to be able to have them all, because everyone at some age really does end up with some urological issue.
You can have a his and her gains wave,
Yes,
Femi wave at the
yes,
same time, like a his and
absolutely.
her massage.
Absolutely, side by side.
So what's the most rewarding thing about what you do?
I really did go into urology so that women would have an option in terms of seeing women. And I do feel like, every day I have women who say, my bladder is falling out, I leak when I have sex. These are things that I don't feel comfortable talking to a man about. And so they do feel more comfortable talking to me. And then when I'm able to fix those issues, and after surgery or after whatever treatment we've given them, they're hugging me. They literally have tears in their eyes in terms of how it's changed their life. That really is so rewarding.
I know you won the Patient's Choice Award, which I think is probably the biggest compliment you get, because you won that a few years in a row.
Yes, it's by Orange Coast Magazine.
That's awesome. Now, anybody listening to this, if they want to get in touch with you, how do they do it?
Feel free to call my office. And
Do you have a website?
yes, my website is www.drgabal.com. That's drgabal.com. Or you can just, search up Google Dr. Gabal or Prestige Medical Group. And we're located in Orange County, California, not Florida, and it's in Santa Ana. Our practice is in Santa Ana.
Awesome. And you offer a lot of private pay concierge options
Yes.
as opposed to everything. I know you do everything else. So.
Yes. So we have a big, very busy practice on the general urology insurance side, but we also offer lots of complementary services, like the MonaLisa, which is a vaginal laser for atrophy. We do PRP, the O shot, the P shot, which is also complementary
People
to
get
the
great
gains
results
wave.
with it?
Yes, absolutely. Especially in combination with other therapies. Regenerative therapies are huge right now, and I think we're just hitting the tip of the iceberg in terms of cell regeneration and tissue regeneration.
Any thoughts on regenerative stem cells, exosomes? Is it still way too early?
No, I think there's lots of good data, like especially in the wound healing data. There's so much good stuff out there. And, it really depends on the source of the stem cells and the exosomes. Even for PRP, a 90-year-old patient's PRP is not going to be the same as a 20-year-old patient's. And so you really have to have good quality cells to have good tissue regeneration. But I think it's the wave of the future, prevention.
Awesome. So anybody listening to this, if you don't have a duvet in your house, go out and get one. Clean your butt.
That's the take-home message.
The take-home, just simple language. Clean your butt for a lot of reasons, but it may avoid a trip to the doctor.
Yes.
I'm so honored to have you. Thank you for taking your time to come out to South Florida. Love to come visit you out in California. Again, if you want to get in touch with Dr. Gabal, it's drgabal.com. Thank you so much.
Thanks for having me.